So let's continue looking at the physiological responses here in terms of reproductive physiology, looking at the reproductive arousal response and then the initiation of pregnancy. So we talk about reproductive arousal. We're talking about a psychosomatic response to a cognitive or a psychological attraction to an individual. This attraction leads to initiation of uh, psychological as well as somatic responses due to circulations of oxytocin that has an initiation in the attraction response, but it's also going to be involved with friendship and clan group behaviors that have nothing to do with reproductive arousal. The circulating levels of oxytocin will increase the likelihood of you developing friendships with individuals regardless of whether or not you have any type of reproductive arousal or attraction to that individual. So we're going to look strictly at the attraction leading to reproductive arousal here. And so what we start off with this cyclic response. The cyclic response starts with a psychosomatic arousal leading to oxytocin release, leading to attachment and love, leading to additional psychosomatic arousal, leading to additional oxytocin release, leading to a change of psychological state. This change of psychological state, if met by the person of attraction, will lead to mutual attachment and will lead to secondary responses that we see within reproductive arousal. If not, it will lead to a differential psychological state that can be classified as a stalking behavior between individuals. Within this, we will start seeing a change of outflow. The change of outflow leads to a change of autonomic tone. This change of autonomic tone leads to both sympathetic and parasympathetic responses. It also leads to a reduction of aromatase activity and an increase of circulating levels of testosterone for both males and females. One of the principal psychosomatic responses that can come about from arousal and attraction is what we usually refer to as open mouth kissing. And the open mouth kissing increases the testosterone in circulation through transmission of testosterone between the male and the female. As we start getting a change of autonomic tone, we start seeing an increase of hypersensitivity within mechanoreceptors, which feeds back, inducing additional oxytocin release, which causes additional autonomic tone changes and additional testosterone circulation. This leads to two distinct things. It leads to a local bradykinin response as well as a systemic cardiac shift episode. The cardiac shift episode leads to engorgement of spongy tissues. The engorgement of spongy tissues with local bradykinin signals and the change of autonomic tone singles back and leads to a cardiac drift episode, which will lead to the change of heart rate that some people will attribute to a fluttering effect during this initiation of attraction. This leads to additional hypersensitivity within the mechanoreceptors, particularly within mechanoreceptors surrounding the spongy tissues of the reproductive system. The engorgement of the spongy tissues for males leads to a slight retraction of the scrotum with the engorgement and elongation of the penis. The retraction of the scrotum is due to the continuation and contiguation of skin around the penis and the scrotum that is the remnants of the fetal developmental structures of those tissues. We start getting movement of sperm through the vas deferens. We get straightening of the vas deferens. We start getting engorgement of the bulbal glandal tissues as well as engorgement of the prostate. Most of the engorgement here is due to the fenestrated capillary networks and sinusoidal capillary networks within the spongy tissues, trapping blood within them. We start getting a release of seminal fluids. The seminal fluid release here, along with the secretions from Cowper's gland, will start to neutralize any urine and urine remnants that happen within the urethra. For the females, we get distension and engorgement of the clitoris outside of the labial lips. We get increased mucus secretion from the Skene's gland, as well as increased immune cell activation within the vagina. We get swelling of the vagina and alignment of the vagina towards the cervix. As long as there is a continuation of psychosexual arousal, we start getting dopamine coming into play. as we get a rush of dopamine within circulation, this dopamine heads out and it will initiate additional oxytocin release. We get a wave of oxytocin, we get a wave of dopamine. The wave of oxytocin and the wave of dopamine lead to what we refer to as the orgasm response. In the orgasm response, we get full fulfillment of engorgement, leading to a full erection of the penis. The full erection of the penis will allow for the initiation of peristaltic contraction of the bulbar cavernosal muscle, starting at the crus of the penis, leading to ejaculation of the ejaculatory matrix, including the sperm. For the female, there gets additional secretion of mucus from Skene's gland. The mucus secretion plus the increased immune response is there to protect the vagina from the penetration that will take place with the penis. We get enlargement of the cervical opening. We get alignment of the vagina and the uterus through a peristaltic contraction. We get straightening of the fallopian tube and angulation of the vagina and the uterus towards the ovary that has ovulated or last ovulated. All the changes that we see on the female side of the orgasm response here is all done to increase the likelihood of interaction between the sperm and the oocyte. The peristaltic contractions for the males take place within a 1 to 2 second intervals, lasting somewhere between 20 and 35 seconds, whereas for the females will take place in 30 to 60 second intervals and can take place over multiple periods of time, some lasting as short as 2 to 3 minutes, some lasting as long as 20 to 30 minutes. Upon termination of the peristaltic contractions, there is a release of beta endorphins. When we combine the beta endorphins with the increased levels of oxytocin, it leads to what is usually referred to as a euphoric psychological condition and a total body relaxation. The euphoric condition and the total body relaxation is an attempt to conserve energy for both the males and the females so that a secondary psychosexual arousal can take place, and for the females to increase the likelihood of interaction between the sperm and the oocyte. The interaction between the sperm and the oocyte is referenced as fertilization. Fertilization is going to take place in 3 distinct steps. The 3 distinct steps we refer to as penetration, activation, and fusion. The penetration here is not the penis entering the vagina. The penetration here is the sperm digesting its way through the corona radiata.
Look at the beginning of development, looking into the ovary at an unfertilized egg. It then gets fertilized by sperm, which travel down the fallopian tube. So here, millions of sperm coming along. Several of them will hit the egg and try.
While several sperm will go ahead and attempt to enter into the ovulate, only one will be able to do so. As it does this, it initiates a response within the ovulate and within the oocyte to finalize the biotic division. At the same time, it will trap all sperm that have not entered into the oocyte within the zona pellucidea as well as within the corona radiata. This ensures that one and only one sperm will be involved with the fusion process that takes place. And so here we go. We have all. So what happens if fertilization and then subsequent implantation takes place? The pregnancy event. Well, there's going to be a change of hormones. And the change of hormones is there to ensure that the endometrium stays in its proliferative phase. The change of proliferation ensures that we get a large, robust endometrium that will allow for implantation to take place. Any drop of progesterone will lead to the initiation of sloughing and the termination of pregnancy. So if we don't see the spike, there's no implantation that can take place. So what ends up happening is that the initial fusion leads to a change of signals in terms of hormone signals coming from the ovulate, the zygote at this point in time, and then the embryo. This is going to ensure that the uterine endometrium stays maintained, and there's a place for the embryo to implant. This is going to lead to changes of hormone signals, in particular HCG, and then placental growth hormone, referred to as HCS. This allows for a maintenance of the placenta as well as high levels of estrogen and progesterone. And if at any point in time progesterone drops, sloughing will immediately take place. And so what we see is we see this hormonal change. The spikes of hormones that we see in circulation, particularly from HCG, will not occur until after implantation has taken place and the formation of the placenta has initiated. So we'll see pregnancy, quote unquote, take place before we actually can measure pregnancy, which means that the zygote has been formed before we actually have any signals that pregnancy has actually commenced, because we're not going to be able to hormonally register this until we start seeing circulating levels of hormones. Sperm coming along, one is going to start to release its digestive enzymes and be able to work its way into the corona radiata, into the zona pellucidea. We have the activation, which freezes everything in place, and we have activation within the oocyte that reconfigures the cytoskeletal protein so as to allow for the two nuclei to fuse.